continuing care spaces for our seniors. But as we found when we talked to 10,000 seniors and 100 stakeholder groups, things are changing. People don't want to live in a hospital bed, they want to live in a home. So we were lucky to be chosen here in Red Deer to have Villa Marie, the new 100-bed continuing care center that is going to have a new model. The new model is that once you're placed into care, if it's at level 3, and then your care needs get greater, you're not going to have to move. You get to stay in your room, in your home.
I don't think we need to be having folks taking up beds in the hospital. And when I was on council, one of the things that was a huge issue were the number of seniors who unfortunately had to stay in hospital because there were no beds available. And that takes up the beds for people who do need them. So clearly, 1,500 long-term care beds, expanding the health care, and spent $100 million towards home care and improved services for the 100,000 Alberta seniors.
The party believes in public-funded care facilities for seniors, but first and foremost, we think that seniors should be given the opportunity to live in their home for as long as they're able to, with support that they need. The Alberta Party knows that there are too many seniors who occupy hospital beds that should not be occupied by seniors because their needs are not addressed in the hospital.
And in Red Deer, we currently have the same number of nursing home beds, continuing care beds. We're now all getting up 90,000. We have the same number that we were 40,000. This is not a problem that just happened. So yes, we are all making promises. We all sounds good. But we also have to, and one other thing, we're talking about the models that we're doing, it has to be the care that's appropriate. So it's not necessarily just building buildings, it's the home care, it's the day care, it's all the other support services.
Again, a priority, the long-term care facility beds for the Waterloo government. It's just having a trickle-down effect into all of our healthcare needs and is affecting the whole healthcare system. And it's only going to get worse. It needs to be addressed immediately. You know, we have seniors that are, or a generation of baby boomers that are coming up through the system. We haven't even met the needs of the existing seniors with respect to this issue of long-term care beds. It is a priority, and it has to be almost key priority 1.